So I want to talk a little bit about gender roles. This is very significant in the Latino culture. There can be an emphasis on more traditional gender roles. So the two more basic ones that everybody has heard about, machismo and marianismo. They're both very focused on family first. These gender roles, however, dictate the decision to seek health care for symptom recognition and disease management. So it's very common for the mother of the household to become aware of symptoms and to become aware of pain and to become aware of the distress, but she then has to go to the dad to say, hey, this is what's going on, and dad gets to decide if we seek treatment or not. Right? So there is, kind of that combination. And there's a whole host of reasons for that, but it's important to realize that when somebody finally does come to treatment, it has gone through an entire process of family and social interventions, and to get to the doctor's office is not usually the first line of treatment. Again, it goes back to the economic reasons. If dad says we can't afford it, we're not going to do it. So the family of origin also sets the stage for pain behaviors and adaptive coping. And again, this is the case for every culture. This is not just for Latino culture. And gender socialization is influenced by family generations. So again, thinking back to the historical considerations, if generations have been here for, or a Latino group or family has been here for generations, but we're assuming just because they're Mexican or just because they're Latino that they just immigrated, then that can have an effect on how they manage their pain or health. Social class has a lot to do with that. And then, of course, educational levels. If people are not educated about the different options for treatment or exposed to the different options, then it's less likely they will use those. So another quote here. I was brought up the Mexican way. You're supposed to take care of your kids. You're supposed to do things for your kids. You're supposed to be the mother. When I had pain, I couldn't be the mother I wanted to be. I don't want my son to help me clean the house. That's my job. As a mother, that's my job to clean the house. As a woman, that's my job to clean the house. I see this quite a bit. It's one of I would say the primary stressors for women in pain is that they're not able to do their motherly, regular household chores and duties, and then to have to ask their especially son or their husband to do it can cause a significant amount of stress. And then on the other hand, we'll talk about the male side of it. If a man can't provide for his family, that can have a significant effect psychologically. So I'll talk a little bit about men and pain expression. There's been some studies done. This actually comes from Dr. Yvette Flores' recent book on Chicano mental health. Men who appear stoic and disconnected tend to spend a lot of emotional energy on suppressing anger. They may be embarrassed or apologetic of demonstrating their emotions. This is often fueled by the daily microaggressions and discrimination that Latino men usually face. These daily indignities, and I've seen it firsthand. I've met with a lot of patients that have this, and it's unfortunate that it kind of gets glossed over because there is this marginalization of Latino men and constant exposure to different racist comments or discriminatory comments, and this all kind of adds up to attack the body, the mind, and the heart and spirit, really. Latinos learn at a very young age that they are part of a marginalized group. One of my very good friends and mentors, she came from Latin America. Her family raised her family here. She's a doctor, professional. And her son was raised in Berkeley. And at a very young age, I think she said he was about 10 or 11, when he noticed that when he walked down the street, people crossed the street to avoid him. And he came home one day, very educated family, higher socioeconomic status, and he came home and discussed this with his mom and said, Mom, why do people try to get away from me? What is it that's happening? What is it about me that people want to avoid? So they see him. He's a Latino. He was born here, speaks perfect English, but because of the way he looks, people already assume that he's some type of threat. So at about 10 years old, this young boy noticed that. And that's usually about the time that young men notice and realize that they are part of a marginalized society and therefore start to behave and react in ways to maybe even protect themselves from that and even, kind of stay away from the dominant culture. right? Try to resist medical care because it's part of a dominant culture. Try to resist, treatments or even advice because it is part of the culture that is rejecting them. So a couple of few men here who I find very interesting. We have Cesar Chavez, Edward James Olmos, and then Vicente Fernandez is actually is considered in Mexico the face of machismo. He is like the most macho of all the men. He's a singer, a very awarded singer, and he's considered kind of the poster child of being a macho. So I want to share a couple of cases here. This is my the male expression of pain, what I call the case of the hidden monsters. Probably about 4 years ago, I started noticing that there were a few men, and in total so far, I have myself documented 5 of these patients that tend to show the same type of symptoms. And I haven't been able to find anything in the literature, or even mental health or cultural, that explains the way that they're expressing their pain. Most of, all 5 of these were between the ages of 35 and 50. They were all first-generation immigrant Latinos, low socioeconomic status, and a primary level or no education, obviously limited English skills. So all of them were injured at work, and all of them worked in very physically demanding jobs, physical labor. And they were the primary breadwinners of their family. So when they were injured, for many of them, for most of them, they had an orthopedic injury, a very specific injury, but to them it was unexplained. They didn't understand what had happened to them. They couldn't understand why they had pain. They couldn't understand why they were feeling what they were feeling and why they just couldn't go back to work. So the common thread here for all of them was this catastrophic thinking. They all thought, if this pain doesn't go away, how am I going to provide for my family? What is my wife going to think of me? What are my children going to think of me? How am I going to function in this society? Where am I going to go? How am I going to live? So there's a lot of this catastrophic thinking. Now, it might be very different from what we would think of as catastrophic thinking amongst other cultures, but these are very real situations among Latinos when there's the threat of maybe being deported, or there's a threat of if you can't physically work, what are you going to do? You can't just go to school or retrain or get that vocational voucher and have some new type of training. That's not valid for this population. So there was a lot of despair. And at some point, they all became very willing to do any type of extreme care. Most of them said, sign me up for surgery right now. I want them to open me up and take out whatever is bad, fix it, make it go away. And for most of them, they were on significant amount of medications, pain medications, neuroleptics, not antidepressants, believe it or not, anxiolytics, a lot of habit-forming medications. So, and what ended up happening for most of them is that they had a lot of cognitive disruption. So they weren't thinking very clearly, they were sleeping most of the day, and then the depression was kind of accumulating. So their response that I noticed in working with them was that they would come into my office and be very stoic. I'm good, everything's fine, I'm a man, I'm strong, I can handle it. But for all 5 of them, at some point in my treatment, they all had a dissociative episode. And some became violent and started screaming and lashing around the office. Others kind of digressed a little bit and went to almost like a childlike mode. Others would, just kind of check out and be almost catatonic. So they all had at least one dissociative episode in treatment while I was seeing them. And the angry outbursts were usually what came out during. So they, for the ones that would kind of check out mentally and then they would get really angry, when they would come back to their consciousness, they had no idea what was going on. So I would check in and say, hey, what just happened there? What's going on? What are you talking about? What do you mean? No, we were just talking. So they were really dissociating from that experience. So, these outbursts also led to memory loss and then some type of trauma response. So there's significant, the primary themes that I picked up with them was a sense of loss of self-worth, their duty, income, respect, not being able to feel as manly, losing their manhood, and feeling ashamed. Female expression of pain, matriarchal role plays a big piece of it. And this is, the purpose for family. Latinas may be unwilling to seek conventional medical treatment because of a lack of healthcare benefits, but also because of being embarrassed by being touched by a male. That's actually something that's kind of taboo. And then there's concerns about language, stigmatizing attitudes, fear of using pain medication, and even fears about their immigration status. A few other Latinas here, some of them know. Dolores Huerta is Cesar Chavez's counterpart. Quickly, I'll go over, this is a very interesting case of a lady that I worked with that had a very long-standing history of trauma and had work-related injury. Trauma history, limited English. Her pain expression turned out as a paralyzation of her arm. And the interesting thing is there wasn't really anything to back it up. The diagnostic studies were fine. She'd had some procedures, everything was okay. But she was walking around for years with this paralyzed arm. So as we started to work in therapy, what I found about her was that she was holding on to a lot of anger. And there was a specific healthcare provider who she was directing this anger towards. So outwardly, she was very happy, very jovial. Oh, yes, everything's great. But there was a sense of depersonalization in that paralyzed limb. So what I did with her is we worked very closely to do meditative practices. I taught her some mindfulness strategies. And we started doing guided imagery, but related to her arm. And at one point, I brought my physical therapist in on the treatment, and we were doing grip strength testing. So what I had done with her before was gotten her into a place of imagery to take her to that place of anger. So I said, okay, now close your eyes. And before we couldn't even get her to do zero grip strength, which is actually pretty hard to do. So we had the grip strength goniometer, I think it's called, and she couldn't squeeze anything. So then I was whispering in her ear, think about that person. Think about that person. Bring him up in your mind, and just kind of giving her these cues. Just let it out, let it out. And she squeezed the crap out of that goniometer and got to, I think, a 40-pound squeeze, which was unbelievable. My physical therapist looked at me. She didn't know what to do. I said, let's do it again, let's do it again. So I said, okay, now put it at another level, squeeze it again. And again, I said, think about that person. Tell them what you want to tell them. Tell them how much you hate them and tell them how mad you are. And she let out this scream and squeezed it to 60 pounds, and it was a miracle. That was the last stage of the treatment. I was only going to see her one more time. Her arm was better.